So we're starting out on infections, and we're going to start out with wound infections, right? And you'll notice we're going to go by systems after that of the body. And definitely for these units, follow my objectives, right? We're not going to cover every disease in every chapter. I'm sure you guys are happy about that, right? We're going to just do a select few from each one. So it's really important to stick to the objectives, and it definitely would be beneficial for you guys to read ahead of time. And I'll make sure I have my objectives posted way ahead of time coming up. So you need to be able to list or identify, right, the situations that increase the chances of a wound becoming infected, right? So how virulent the infecting organisms are, right? And so virulence is a term that we're going to use quite a bit, and this refers to, we've already studied the immune system, right? And we talked about how some of them can escape phagocytosis, or some of them can evade detection by phagocytic cells. Some of them produce toxins, as we'll find out. These are factors, virulence factors, that make them pathogenic, right? It's why we get sick, because they get past our immune system, or they evade it for a period of time, right, and cause injury to our bodies. How many organisms are there, right? 10 organisms, as little as 10, right? What we call an infectious dose of Mycobacteria tuberculosis, if inhaled, could cause that disease, right? That's a very low number, right? Highly virulent organism. Where other infections like salmonella, you'd probably have to ingest thousands of bacteria that enough get through your stomach and that stomach acid to actually cause an infection in your intestines. So the number really depends on the organism, right? And that first factor of how bad of a bad guy is he, right? So typically we refer to the infectious dose as that minimum amount that you need to cause an infection with that organism. So this is going to vary from organism to organism. And then, of course, we're dependent on our immune system, right? How good is it functioning? That's a factor, right? If someone's immune system is deficient and they get an infection, that maybe one of us whose immune system isn't deficient, we'd handle it fine and not even knew we were maybe even sick. Where they would be completely debilitated, maybe even hospitalized, or even possibly die, right? Because your immune system is your protection. If it can't protect you, right, if it's deficient, then you're definitely going to get very sick. And then when we're talking about wound infections in general, this is how they're gaining entry, right? We have some type of wound. But not all wounds are the same, right? Some of them are crushing wounds. Some of them may contain foreign material, right, when you get a splinter. Those types of wounds, right, can create an environment where it's much harder for those wounds to heal. And especially with foreign material, usually the foreign material needs to be removed because it could be harboring the microorganisms and they could keep coming out of it. So like the splinter they show in that game that I sent you guys to, the bacteria just kept coming out of that splinter, right? So unless you remove that, they're just going to keep coming out. And our white blood cells can't crawl into that splinter. They're going to wall off around it, right? But they can't get inside, okay, to that foreign material. So you need to be able to list and define the 5 different types of wounds, right? So we classify wounds in 5 different categories. And then as we look at these categories, we need to know which ones could favor anaerobic bacteria. So where we create an environment where oxygen is not getting in. And this can be bad news because some anaerobes, right, really pathogenic. I keep saying I'm going to add pictures to this, but I still haven't. But most of us know what wounds look like. An incision, right, or something that's been incised, has usually been cut by a very sharp object, a knife, right? Even paper, right? Paper cuts would be considered like an incision, although those tend to be minor. They hopefully don't go too deep. But it's a nice clean cut with clean edges. A puncture wound, the difference there is that it goes deeper than the wound is on the surface, right? So it's puncturing inward. And this is one of the ones to star because of the nature of that wound, right, that it's deeper than it is at the surface. Chances are it can seal up at the surface and create an anaerobic environment deep within your tissue. Lacerations, this is where the tissue is torn, where you don't have clean edges, right? When it's torn apart. Contusions or concussion, this is usually due to a blow, right? You sometimes might have a cut, and this is also why you need to keep an eye on it, right? Sometimes we bruise ourselves. If you bruise and cut yourself, this is a double whammy, right? Because when you bruise, you cause damage to the tissue and to the blood vessels, right? That bruise is the blood leaking out of those small capillaries in that area. And until your body can clean up that mess, and depending on how much damage you did to those cells, a lot of times you'll get an anaerobic environment. Now, if you don't have a cut, chances are no organisms got into that anaerobic environment. But sometimes, right, even the most minute cut, you didn't even notice it, and organisms are introduced in. So this is another one where you could have the potential for an anaerobic environment. When you have these contusions, when you have these blows that crush tissue, damage it, right? Commonly what we refer to as a bruise. And burns have to be some of the worst, right? Thermal burns we're most aware of, right, by heat, but chemical burns can happen sometimes too. And when it's burnt, whether chemically or by heat, thermal, that tissue is dead, right? So that creates an anaerobic environment as well. And the bad news with that is if the tissue is dead, there's no way for white blood cells to get to that area, right? And you cannot revive dead cells. They're dead. So it just becomes an area where microorganisms can grow, right? And a lot of times, too, it's going to be an anaerobic environment, which can be very dangerous. So one of the therapies they use a lot nowadays is hyperbaric oxygen. Have you guys heard of that? Where they put you in a pressurized chamber, or your arm or whatever it is into a pressurized chamber, and they pressurize oxygen into the wounds, right? And this is to kill any anaerobes and also to speed up the healing process because, again, your cells need oxygen to metabolize, right? So it's twofold. So for any infection, the most important part is attachment, right? And when our skin is breached in our tissue, there are major components of our tissues that the bacteria or microorganisms attach to. So specifically, they're attaching to your collagen, your fibronectin, your fibrogen, which is the inactive form of fibrin, which is the protein components that help form clots, right? So these are your components, right, that they're attaching to. But this stuff isn't available unless the skin is breached, right? This is at the tissue level. There's really no way to stop them from sticking to this, unfortunately. So what is the benefit and what are the potential harmful aspects of an abscess formation? So first of all, we actually need to figure out what an abscess is, right? So what an abscess is a localized collection of pus, and we know that is mostly what? Dead neutrophils, right? Surrounded by body tissue. So this is in your tissue, right? Deep in your skin is where abscesses form. The purpose and why they form is to localize them, right? Try and trap them into a particular area. The problem with this, right, is eventually they need to leave, right? This collection of dead neutrophils, right, this pus, the bacteria themselves need to leave the area. And so sometimes they'll work their way to the surface on their own and they'll bust, right? And you get the yucky, pussy wound, right? That you definitely want to watch and keep clean. Sometimes they won't rupture to the surface on their own, right? And they'll keep building and building in the tissue. And in that case, don't mess with it yourself, right? You go to the doctor, you have it aseptically, right? Lanced under clean conditions, properly cleaned, right? Is what you should do because you risk infection. Plus, if you don't do it properly, the bacteria are in that pus, right? And if you puncture it and you don't do it in the right way, you could actually cause it to spread, right, in your tissue, right? So you can make the infection worse. So that's the downfall with abscesses, when they don't bust to the surface, right? And when they themselves become a source of infection for other areas. So when we can't contain it in that particular area, right? Because maybe you try to take care of it yourself, right? Or just naturally they can escape. So they can be a source of infection for other areas of the body if it doesn't break through the surface, isn't properly tended to. But again, just like inflammation, it's a natural occurrence that will sometimes happen. Most of the time your body can take care of it on its own, right? But there are times when it just keeps growing and you need to go get help. Don't take care of it on your own. Make sense? Okay. So we're going to look at some specific infections now caused by specific organisms. So you'll notice there's a list of things that we need to know for each one of these. And remember I said I'd never shut up about gram-positive and gram-negative, and I wasn't kidding, right? So especially for bacteria, we want to know if it's gram-positive or gram-negative, because this tells us about the cell wall structure, right? And one of the things that we're going to start talking about too is antibiotic treatment, right? And next week I'm going to actually bring in some real cultures for you guys to see some of this stuff, but I have pictures in my PowerPoint as well. It's not going to jump off the Petri dish at you. Right? It'll be sealed up and safe. Wouldn't expose you to any pathogens, right? Can it grow under anaerobic conditions, right? So this is important, especially if you have a type of wound where you could get anaerobic conditions, right? So if this is one that can grow anaerobically, then it's going to create a problem when we have those type of wounds, right? When we have burns, when we have punctures, when we have contusions. We need to be able to name the products the cause of an agent produces that can be helpful in the identification. So this particular organism produces some specific products that'll really help you in the identification of it. So a lot of infections have distinctive symptoms, right, that also will clue in a doctor as to what's going on. And one of them for this organism is smell. But the interesting thing with smell is some people don't always interpret it the same. So that's another reason why I'm going to actually bring this organism into class for you guys so you can actually smell it. For some people, it smells kind of musty, like a dirty sock left in a locker room kind of smell. Other people actually smell a sweet component to it. It actually smells kind of sweet to them. So it's an important smell to know, though, because, like I said, it's distinctive and unique to this organism. Name the reservoir. So we're going to always be talking about where does this causative agent come from? Where does this bacteria, where does this virus come from? right? Its reservoir, where does it live? The process of pathogenicity, is why is it a pathogen? How is it that it makes you sick? So basically this is, how does it evade your immune system? Or what damage does it cause to your body, right? What basically does it do that gives you the symptoms that we'll talk about? And this guy does produce toxins under certain conditions. So we're going to list the types of toxins, the types of damage that they cause. List the preventative measures, right? So a lot of infections can be prevented, right? How could we prevent getting this type of infection? And then we'll also look at treatment, right? So these are main things that we're going to look at for most things, right? Distinctive symptoms, right? How does it make us sick? How can we prevent it? How can we treat it? So Pseudomonas, the P is actually silent, Aeruginosa, is an opportunistic pathogen. So this is one that's available in the environment, but it usually doesn't make us sick unless certain conditions are present. And so the condition probably for this poor person in this picture, I'm thinking was probably a burn, right? So a large area of dead tissue. This organism is prevalent in the environment, in the soil, right? So they could have easily picked it up and had it on their skin. It's a major cause of pneumococcal infections. These are what are commonly referred to as community-acquired infections. And what community usually is the biggest problem? Anyone know? Hospitals and nursing homes, right? Where you have elderly and sick individuals, right? They're more susceptible to infection. So this organism, as you can see in these pictures, produces a green discolorization because it produces two pigments. A blue and a yellow pigment. And remember from pre-K, right? Mixing those two colors together, blue and yellow gets green, right? And so you see this green discolorization. Here's the and here's them growing on an agar plate. You can see again that greenish color. And then the bacteria itself, it's rod-shaped and it has flagella. It has one little flagella there, right? So it is motile as well. So again, commonly seen in community-acquired infections, rashes and external ear infections, and usually obtaining this organism from the environment, right? From pools and hot tubs. It can infect the bones of the foot. It can cause serious eye infections as well. It can cause complication with heart valves, infections of heart valves. It can form biofilms in our lungs. The most common places where we run into the problems is associated with lung infections in hospital and nursing home type environments, and burn infections. So there's a close-up of that horrible one. So there's a change in the tissue color. As we said, often see this greenish discolorization due to the pigments that this organism produces. The individual will experience chills and fever, skin lesions, and they may even go into shock if the bacteria gets into the bloodstream. Definitely not something to mess around with. This is a gram-negative bacteria, as we saw in the other picture. It is motile by a single polar flagella. It generally grows aerobically, right? So in the presence of oxygen, but it can grow anaerobically in the presence of nitrate because it's using that as its electron acceptor. So mostly in the soil, it's growing anaerobically. And as we said, it produces these soluble, which means they're water-soluble pigments, right, that will discolor the tissue. So how does it make us sick? The overall effect is it causes tissue damage, and therefore it's going to prevent the healing of any wounds. And there's, of course, increased risk when it gets into the blood, and that it could cause septic shock. And remember, shock is that extreme drop in blood pressure due to widespread inflammation. So some strains, right, so this is going to vary from strain to strain of Pseudomonas, but the toxins that they produce, exoenzyme S leads to cell death. So this is an enzyme it secretes, right, and it binds to our cells and kills our cells. Toxin A halts protein synthesis in our cells under low iron conditions, right? So again, if we've got dead tissue, red blood cells aren't heading into the area, it's not going to be a very iron-rich environment, and it may induce the cells to produce this particular toxin, which is going to kill our cells, right? Protein synthesis is a necessary process for life for a cell. And then phospholipase, C, hydrolyzes lectin, which is one of the lipids found in our cell membrane. So it literally destroys our cell membranes. So the key here is cell death, cell death, cell death. And apparently the pigments they produce inhibit competing bacteria, right? So they're toxic to other bacteria. So there's some evolutional reason to continue to produce these pigments. They're beneficial in helping other bacteria, stopping other bacteria from growing in the area. So they keep the food all to themselves. Epidemiology, right, relates to where it comes from, how does it get where it's going. So we really focus on the reservoir. Where did it come from? Well, as I said, this one is widespread in nature. It's found in our soil, it's found in water, it's found on plants. And this is the main reason in hospitals, especially in burn units, they're not going to have any ornamental plants, right? Flowers, because they could contain this organism. That soil and such could contain this organism. It's also why, we walk on dirt and stuff all the time. So if you go to visit someone, right, they'll have you put the little footies on and everything. This is to lessen the amount of this organism you may track into that room. The bacteria will persist in dampness and standing water. Right, so it can grow in aquatic environments as well. The really bad news is it can contaminate some soaps, ointments, eye drops, swimming pools, like we said, hospital equipment. So this organism is one of the main reasons that sometimes you buy things and they're single use, right? There's a reason for that, because you don't want to risk the chance that when you go to use it again, it got contaminated, right, in between uses, right? So you just use it once and you throw it away, and you don't have to worry about contamination, right? This is true for a lot of eye treatments, right, where you don't want to risk infection. So prevention and treatment. Well, we want to remove, right, the bacteria. Prompt wound care, right? Always, right? Attend to the wounds right away. If you have dead tissue, it is dead. It can't be saved, especially from burns, right? And this is the really awful thing about that, is they literally have to remove that tissue, right? And can be quite painful. And then they're going to follow it up with using antiseptic creams, antibacterial creams. Established infections are usually extremely difficult to treat, and the really bad news when it comes to Pseudomonas, it's resistant to a lot of antibiotics. There's lots of drug resistance. And because of that, we usually have to go to the more powerful drugs, some of the ones that might need to be administered intravenously at high doses. So Pseudomonas, this is a picture of some of the plates that we do in lab. Actually, can one of you guys turn off like the front set of lights so we get better?
Sorry.
Yeah, I don't know. It would make sense it'd be the front one, but it's not. Okay. So there we go. You can see the colorization a little bit better now, right? The greenish to those plates. And then what's on those plates are some antibiotic discs, and this is a particular method, one of many that are employed sometimes for determining antibiotic sensitivity. And so what we do is that we inoculate the plate with the bacteria, and then we apply these discs that have a set amount of the antibiotic. And then we come back the next day, and we're going to measure this zone of inhibition where the bacteria didn't grow. And then there's a table associated with this chart that will tell you how many millimeters you have to have for it to actually be sensitive. And I can tell you, I think only one of them on here actually was, only one of the antibiotics was it sensitive to. Okay, and this is penicillin right here. No inhibition of growth at all. Plain old penicillin did nothing to this bacteria. Anyone want to gander a guess why? Remember how I said I'd never shut up about gram-positive and gram-negative? Which one is this one? Gram-negative, right? So why is that important information? Because things like penicillin usually don't work on gram-negatives, right? Only gram-positives. So it makes sense, right, that the penicillin wouldn't work, right? We wouldn't even normally bother testing this, right? If you know about this organism, you wouldn't bother putting it on there. We do it for demonstration and learning purposes, right? That penicillin does nothing to this bacteria, right? Gram-negative in general, for the most part, are innately, because of that outer membrane, resistant to penicillin, okay? Other drugs work against different things. Remember, penicillin affects the cell wall, but it can't even get to it inside the cell to cause any problems because of that outer membrane. So we should have been able to answer all these questions, right, as it relates to this organism. And I'm not going to go back through them this time for the sake of time. So tetanus, right, I'm going to lecture on it, and then we're going to see if we can answer all these questions, okay? So tetanus is known as lockjaw as well, and the reason for that is the symptoms tend to manifest first in the jaw region. And of course, this is a horrific picture, right, of an infant with this infection, and you can see they're clinched up, and the problem with this is it stops your muscles from relaxing. And the reason why this infant probably got the infection is the umbilical cord, when it was cut, it was probably not done cleanly, and it got infected. And so it's very rare, right, for us in the United States, but quite a serious problem in developing countries, right? You'll see things, unfortunately, like this. The spores themselves are highly prevalent all throughout the world, right? So this is one of the things we talked about, these endospores, right, and how they're resistant to environmental conditions. So it's very difficult to avoid exposure to this. But do any of you guys know what protection we have against this particular infection? Vaccination, right? Vaccination. And we'll talk about that. That's actually a very special vaccine. So early on, right, they're going to experience restlessness, irritability, difficulty swallowing. As I said, contraction of the jaw muscles is where it tends to manifest pretty soon. Convulsions, particularly in children. Later symptoms, an increased muscular involvement, right? Severe pain, difficulty breathing, because we use muscles to breathe, do we not? Yeah, so, and because of that, the less intake of air and such can leave us predisposed to pneumonia. And in fact, it's usually a secondary infection that gets people right, due to pneumonia in the lungs, an infection of the lungs, and regurgitation of stomach contents up into your lungs. So it can be quite painful and horrific. So Clostridium tetani is the causative agent. That's the name of the bacteria that causes this infection. It is anaerobic. It can grow without oxygen. So again, we got to think about those types of wounds, right, where this spore would get in, right, and germinate and start growing. It is gram-positive. As you can see in the picture, it's a bacillus. And then, as we said, it's a spore former. And it swarms when it grows on laboratory media. I don't have a picture of that. It's kind of cool. It kind of spreads out. So what's the bad news with this guy? Once it starts growing in your wound, it produces a toxin. This toxin is referred to as tetanospasminum. And this is responsible for the pathogenic effects. When it produces this toxin, it binds to receptors on our motor neurons. So these are the neurons that tell our muscles what to do. And it blocks the inhibition of the motor neurons, causing paralysis. And what this means is that the muscles stay contracted because our inhibitory neurons tell them to relax, right? So they're not getting that stimulus, right? The inhibitory motor neurons are being shut down, right? So the muscles stay in contraction because they're never signals to relax. So where is this found? As I said, in dirt and soil just about everywhere. You can even get it in your gastrointestinal tract, although usually it won't cause infections. Just you ingest it, it goes in one end and out the other, right? Because remember, your intestinal tract is considered an external environment. Nearly half of infections resulting from puncture wounds. Well, why puncture wounds? Like piercing and tattooing and animal bites and drug abuse. These piercing wounds, these puncture wounds. Why is it that they would contribute to this infection? What type of environment can form in a puncture wound? Anaerobic. And did we say this one can grow anaerobically? Absolutely, right? And so that's why when people get, all freaked out when you like step on a rusty nail in your yard, it isn't the rust, y'all, that should freak you out. The rust is an indicator that has been in your yard for a long time, right? Although in Louisiana it probably didn't take too long, right, for rust to form. But it's an indicator it's been there a while. And a nail is going to create what type of wound? A puncture. So something that's been in the environment for a long time, what are the chances it has spores on it? Pretty high, right? And you just created a wound, right, that would potentially result in an anaerobic environment, right? That's the frightening thing about that. Animal bites too, right? They tend to have those incisors, right, that are pointy, puncture type wounds, right, we're talking about. 30 to 60% of the cases in the United States annually, right, with a 25% mortality rate. What does that mean? What does mortality mean? Death, right? But what's the good news? What's the flip side? Immunization, right, can decrease instances in economically advantaged countries. Again, we see more of a problem where they don't have access to proper medical treatment, right, and don't have the availability of vaccination. So depending on your vaccination status, this is the one you have to keep up with even when you're an adult, right? Every 10 years you should get your booster. If you have not been vaccinated in the last 10 years, if you get a wound, right, they're going to vaccinate you, right? So notice they're going to vaccinate you. Toxoid is the type of vaccine they're giving you. This vaccine is just the toxin that's been modified, right? So that you will produce antibodies against this toxin. So you can do what to the toxin when it gets in? Neutralize it, right? Bind to it with your antibodies before it binds to your inhibitory motor neurons. Okay. The other thing they have here is TIG, and this is tetanus immunoglobulin, right? So from individuals that have been vaccinated, when they donate blood, they can take these antibodies from that sample, right, and save it to give it as a treatment to some people, right? So this is what we sometimes refer to as anti-serum, right? So we're actually giving them the antibodies against the toxin. So notice the only time we're going to do this is if it's not a clean wound, right? And we don't know their status. They're also going to vaccinate you so that we know from now on that you've been vaccinated. So again, if your vaccination is unknown, right? Or if it's past the 10 years, they're going to vaccinate you. Other wounds, right, more serious wounds, if it's been in the greater than 5 to 10 year gap, they're also going to vaccinate you. All right, but we save the treatment for those serious conditions, right, where the wound could more likely could cause, right, illness, where you may be sick. How do we prevent it? Of course, vaccination, right? And as I said, it's actually the toxin they give you, right, in a weakened form. This is also usually one of those vaccines they give in combination, right? They give it with diphtheria toxin, right, and a vaccine against pertussis, two that we're going to talk about later when we get to the systems of the body that they infect. Treatment, of course, when we're dealing with wounds, we want to clean them, and especially if you have dead tissue, it needs to be removed, right, because all it is a place for bacteria to live and grow. Antibiotic treatment is given to kill the multiplying bacteria, right? Because the vaccine's not going to protect you against the bacteria, just the toxin. We use a special antibiotic that targets anaerobes. And then, as I said, we can give an antitoxin, which is an antibody, against the toxin. This neutralizes the toxin attached to nerve cells. Right, so we can actually stop this process. So this is an oral synthetic drug that is a bacterial agent. Flagyl is the product name, you could say. The chemical name is metronidazole. And how it works is it interferes with DNA synthesis and function, but only in anaerobic organisms. And this is because of what they're using for their metabolism. So it interferes with by binding to the DNA, and it'll even cause breaks in the DNA. So it's used to treat things like bacterial vaginosis and Clostridium difficile as well. So the book does a really good job too of having these diagrammic outlines of the major components of the infections. So these are good stopping points, right? A quick read of the major steps in the infection and the treatment, prevention, where it comes from. So what's the name of the causative agent? Clostridium tetani. Is the causative agent positive or negative? Gram-positive or gram-negative? Gram-positive. What special structures do these organisms form that allows them to survive for long periods in harsh environments? The endospores, right? Endospores. Can they grow anaerobically? Yes, right? So what's the type of wounds that provide a favorable environment for this organism? Puncture wounds are the major ones, right? As well as burns or contusions. But puncture wounds are usually the ones we worry about the most. What are some distinctive symptoms of this infection? Right, permanent contraction of your muscles, right? Paralysis of those muscles. Where does it most commonly manifest first? What's the nickname for tetanus? Lockjaw, right? So it commonly happens in the jaw region. What's the name of the toxin? Tetanospasm. What cells in the body is it attaching to? The toxin? It's more specific than motor neurons. They're the ones that tell your muscles to relax. These are your inhibitory motor neurons. Where does this organism live? Where could you find the spores? Dirt, soil, dust, right? Really can't avoid it in the environment. What's the type of vaccine that I named for tetanus? It's a toxoid. It's a toxoid. And that's when they're giving you a toxin, right? So we're not giving you the bacteria. The vaccine is not against the bacteria. It's against the toxin. So it's called a toxoid. So because of that, why does the vaccine not protect you against the bacteria? They're not giving you the bacteria, right? They're not giving you any component of the bacteria itself, right? So we have no prior knowledge of this bacteria, right? But what's the really damaging thing? The toxin, okay? So the reason is you're not being vaccinated against the bacteria. You're being vaccinated against the toxin. What's an antitoxin? What do we say the antitoxin is? Something that goes against the toxin. So what do we know that can neutralize toxins? What does IG stand for? Immunoglobulin, antibodies, right? That's what the antitoxin is, right? Is the antibodies against the toxin. So why would that be helpful? What do we know about antibodies against toxins? What can they do? Yeah, we'll have memory cells, but the antibody itself, how does that protect us? What does it do? So we have a toxin, we have an antibody. What happens?
It attacks it.
It binds to it, right? And because the antibody is bound to it, it neutralizes it, right? It can't attach to our cells, right? So remember that protective outcome of neutralization. And it is just the antibody binding, but by it binding, it stops that toxin from binding to us. Okay, so we're going to stop there for today. So we got, I think we'll have 2 left for next time, and I'll post the next one as well. So actually I do want to record this so that people have it. So I don't know what happened, but it appeared that when I looked at the results while you guys were taking the test, that most of you guys hadn't finished all the connects I told you needed to finish. So I didn't walk around and take away papers because I was hoping there was some type of glitch, right? So if you snuck by, lucky you, right? But for the next bonus assignment, which I'm going to announce next week, you've got to have your connects done, right? And so I'm going to check on Monday. I'll be sending out emails on Monday if for some reason your connects are not up to date, okay? So this is your last chance to get up to date on Unit 1 and Unit 2. Not to say you can't redo them, right? But get them done at least the first time. Because if you wait to the very end, you're not going to be a happy camper, and you're going to lose a lot of points, right? And they're meant there to help you. The good news is that the next units, there aren't too many connects, but there are some additional connects that you guys are going to do. That it's on material you need to review, and I need to know you've reviewed, but I'm not going to test you on, right? So there's one on sexually transmitted diseases, there's one on antibiotic sensitivity. Some of those I'm going to be posting in a folder for you guys coming up. But mostly I just want you guys to get caught up, okay?
So what are you gonna do about the people that lied?
I am